Yeah, so my study was Penpulimab with chemo versus chemo with placebo. It's a double-blind randomized phase 3 study, AK-105304, looking at Penpulimab and chemo combination versus chemo and placebo combination in first-line recurrent metastatic nasopharyngeal carcinoma. The study led to FDA approval of Penpulimab in first-line setting in nasopharyngeal carcinoma. So it was a randomized phase 3 double-blind study with 1:1 randomization. Um, 291 patients were initially, identified. 147 were enrolled in the chemotherapy and placebo arm, and 144 in the Penpulimab and chemotherapy arm. The study at this point of time has presented PFS data, and overall survival data is still uh, being evaluated. It's immature right now. Essentially, a randomized phase 3 double-blind 1:1 randomization. Yeah, so the most important primary endpoint was met. The median PFS from blinded independent central review was 9.6 months in the experimental arm, which consisted of Penpulimab and chemotherapy. And it was, I would say, around 7 months in the placebo with chemotherapy arm. Yeah, apart from that, the overall survival data is still pending. So there are limited treatment options for recurrent metastatic setting for nasopharyngeal carcinoma, especially in first-line space. At this point, only toripalimab based on Jupiter 2 study is approved in the United States. So this provides another option for patients. Secondly, penpulimab, because of its unique mechanism of action of Fc null design, it leads to lesser immune-related adverse events. So again, with the study, we saw that the adverse events were lower than some of the other studies in this space. So it provides a safe first-line option and a second option in recurrent metastatic space. Yeah, I think in future, as I mentioned, overall survival data, once it's mature, would be published. We would also be looking at, some of the other endpoints, like looking at the benefit across different populations, looking at, doing some sub-analysis of patients that had liver metastases, bone metastases, and others. And because of its unique design, it does provide a safe option first line setting. Yeah, so this study was funded by Akeso Bio, a company based in China. And this was truly a global study, which had 36 sites in China and 10 sites outside of Asia.